Hello viewers, I am Dr. Shailes Kumar. Today we'll see a few answers to few of the questions those patients have asked regarding the fibroid in our comment sections. So sir, I have a 6 centimeter fibroid and currently undergoing homeopathy treatment as we do not want to go for any surgery. I heard that treatment suggested by you now is without surgery, but can we have kids after this surgery, and after this treatment how much time we need to wait for planning kids? I heard that UFE we cannot have kids. Please reply sir, we are psychological in trauma. This patient is suffering with a fibroid of 6 centimeter which is a calcified, and thing here is whether it's the kids failure to have kids is only infertility is the only problem, or you are having any symptoms also like overflow or any pain during periods or irregularity of periods or spotting during periods. So these symptoms, and then if the fibroid location is also very important here. In case if it's pressing on the inside of the uterus where the baby will sit and grow during the pregnancy, then this fibroid will not let this baby to grow or pregnancy to continue. If the location is little far away from the baby where the baby sits, then you can continue to have, or better is always to go for this removal of this fibroid either with the fibroid embolization, that is a non-surgical, or you can go for the myomectomy also. In embolization, because this is a calcified fibroid, so in embolization the thing what will happen, we will kill this fibroid, but when it starts shrinking it will not become completely zero, it will come and stay as 2 or 3 centimeter because it's a calcified thing. So those calcifications they will there, but the live and active cells which are there in the fibroids which will continue to grow, those will become dead and they will shrink, but this calcified specks will be there. So now in your case, whether UFE is suitable to you or not, we need to find out where this calcified fibroid is situated, whether inside of the uterus like submucosal or intramural or subserosal. Then if it's intramural subserosal, then embolization is helpful. If it's inside like submucosal, then you better to go for a myomectomy surgery. So medications, homeopathy, I am not sure how much homeopathy will help, but definitely you can try, but make sure that you be in the regular follow-up to see whether this fibroid is growing up, ultrasound like every 3 or 6 months to see, because homeopathy medicines you have to take it for a long time, like maybe 6 months, 1 year or 2 years also sometimes to see the result. And homeopathy medicines, depending upon your body condition, they may or may not give you results. So during that time, like if you are taking medicines for 2 years, there is possibility if the fibroid is not responding, it may continue to grow and become larger in size, and you will lose significant amount of time also during that time when you are planning for kids. And when you go for myomectomy or you will post treatment, you will have to wait without planning the kids for 3 to 6 months, because once you have a cutting or scar on the uterus in the myomectomy, or when we do the embolization to shrink the fibroid, it will require some time for uterus also to heal. So 3 to 6 months anyhow you have to wait, but when you wait for 2 years, and on top of that when you go after the 2 years, then it will become like 2.5 to 3 years of waiting time for you to have the kids. And considering that UFE, post UFE you cannot have kids, no, that is not the case, because we have done the UFE and there are patients who conceived after UFE, so nothing related. But in your particular case, because it's a calcified fibroid, here you may not see the 100% reduction of the fibroid, because it's the calcified things will stay there. Calcified anyhow, they are dead stones, they will stay there, but then in between the normal alive fibroid, which is active fibroid, that will become dead. So it will not go further, but it will not shrink to a 0 point, unlike when we cut and remove in the surgery. So that is the difference in your particular case in calcified fibroid. If it's a non-calcified or normal fibroid, then we could have got a better result in your case to completely shrink. I hope I could answer your question. If you have any further question, you can write to us. We will try to read them and answer them in our next video. Thank you.